The Swift Winter Flu project was something that was set up to try and look at the people who'd traditionally been missed out from flu vaccines. People who were homeless, had no fixed abode, were couch surfing, that were really slipping through the cracks. So the main aim of the project was to extend healthcare to those people. The best answer to that question really is in the form of a patient who I saw when we were actually on the project. And this was a guy who had unfortunately recently lost his father. He'd lost his job and had ended up getting in with the wrong crowd and taking some drugs and making some very difficult lifestyle choices. On the day we were able to offer him the vaccine, and it meant so much more to him. It really was an example of how we as a health service were reaching out to him, were really trying to engage him. And as well as getting the jab himself, he was really, really grateful and really, really positive about the impact that we were having. We've had fantastic response from ICOF Fireside, a great partnership with them, and the actual number of patients that we booked was far in excess of what we had expected. We didn't have a single free appointment. But for me, the success was really on a deeper level than that. Being able to engage with this population, show them their value, show them how we're looking, we're willing and we're helping to look out for them and look after them. The whole team have worked really hard on the project, and I think it was a really, really great success. So in a way, that's been a reward in itself. But to get this award would be a real endorsement for the work that we've done, and it would be a brilliant start to 2016 for us.
The project is the IRIS project, which stands for the Identification and Referral for Increased Safety, and this will be for victims of domestic abuse. It's a training programme, and the pilot is engaging with 19 practices across Sandwell and West Birmingham, and the idea of the project is to go in and train GPs and clinical staff and reception staff to raise awareness around domestic abuse. Research has shown that over a 5-year period, 90% of the female population will access their GP at least once, and gives the GP the opportunity to ask the question and then get that person for increased safety to the right support services. Certainly more high-risk patients have been identified, and that's a high risk of homicide, with more referrals into what's called a MARAC, which is a multi-agency risk assessment conference. There's been increased partnership working across the CCG and Sandwell Women's Aid. So again, a success is getting people to the right support. It's added value to the GP. They can start to ask the question, feel comfortable asking the question, and knowing that there's the right support there when they do.
A GP who received the IRIS training said, "I'm now convinced that violence against women and children is a major public health problem with long-term consequences for women and their families. As an experienced GP, the whole project has been nothing short of transformational."
It's always wonderful to have recognition of subject that both Marie and I have been very passionate about and have put in a lot of effort to make sure that this pilot project has succeeded.
We set up a take-home naloxone programme within our team. Naloxone is a drug that temporarily reverses the effects of opiate overdose, and a take-home naloxone programme is where we train people who are at risk of opiate overdose, typically through their use of heroin or methadone, in how to manage an overdose situation, and then we issue them with a naloxone kit. These sorts of programmes usually exist within drug treatment services, if anywhere. We're not a drug treatment service, we're a GP practice for people who are homeless across Birmingham. So far we've given out over 170 kits to homeless people across Birmingham, and of those more than 40% have gone to people who are not accessing drug treatment services. We've also trained more than 100 hostel staff and homeless workers across Birmingham, because opiate overdoses may happen within the hostel setting, where hostel staff can then support residents who are using naloxone in saving somebody else's life while they're waiting for an ambulance to arrive. We've had 26 successful uses of naloxone reported so far, so obviously that's potentially contributed to lives saved. More than anything, I think for me, it would be a recognition of the work of the individuals that we actually train, because they are putting the training into practice in really challenging situations. They're putting the training into practice, administering naloxone and saving somebody's life.